Welcome to the Enterprise Mobility Roundup podcast, brought to you by Bluefletch. We discuss technology topics related to Android and workforce devices and how they intersect with business and mobility.
Hello and welcome to another episode of the Bluefletch Enterprise Mobility Roundup podcast. I'm here with Lee DeHines, and we're talking about why iOS is no longer good for healthcare or the clinical environment. Is that the correct framing of this? I think we had a more formal title. So this is a working title based on a presentation that we're putting together for some conferences we're presenting at later this year. One of the things we talked about was iOS, beautiful, tremendous, great operating system, awesome for consumer devices, not necessarily awesome in a lot of the enterprise type scenarios that we work with, and a lot of the hospitals and organizations that are using mobility need mobile devices for. So that's the summary for this. Lee, if you have any other color or points on the overall just framing of this discussion.
Yeah, I think we're going to talk about the key differences between what is essentially a consumer grade device and what's an enterprise grade device. And while consumer grade devices are great, they're not great for applications that are not consumer in focus.
So to get us started off, I think that the first framing thing we talked about is the clinicians or healthcare workers that use mobility devices day to day. But we could start about what do they use them for? What should they be using for?
Sure. So a lot of times what's happening now is we're in a BYOD, or bring your own device model, where the consumer grade device is actually being brought to work by the healthcare worker. It's their personal device, and there's a partition on that device where they're actually using it for their work. There are work applications on there. There's access to virtual desktops so they can do EHR charting. They're even doing things like texting in plain text on the device's provided just text platform. So if it's an Apple device, they're going to be in iMessage texting other people, which is not ideal. So they deserve something that's going to be a little more sequestered from their personal life and their personal device. So I think that's really what we're focusing on, is a unified experience.
So the linear background from this is we've gone from the clipboard, pen and paper, fax trolla, fax machine type scenario to we started having workstations over the last 20 years. And then in the last 10 years, we've seen a lot of iPads and iOS, most of them BYOD related. And to your point, yeah, having MDMs managed, like private spaces on those where we can set up, whether it's Epic, Cerner, Oracle, some of these other apps within there. But I guess the actual form factor, the two form factors we're going to see are going to be handheld or tablet as the two primary ones, and then you still have the WOWs, the workstations on wheels that a lot of hospitals use, and I think we've talked about those in some other podcasts. But that's what the technology landscape looks like right now, right?
Yep, that's exactly right.
And I think the promise versus reality. I know Apple has done an incredible job with their hardware. Personally, I have some Apple phones along with Android phones. I have way too many mobile devices. You can probably guess by looking behind me. But the general experience Apple has put forth for the consumer has been spectacular. How, in the world of, when you compare that versus Android, what are some of the key takeaways for why Apple doesn't work as well in a lot of the enterprise spaces?
Sure. So I think, in an enterprise space, particularly in something that's very process heavy and outcome oriented, like healthcare is, the degree to which you can limit variables is going to make a huge difference on unifying a process and unifying positive outcomes. Consumer devices are built for individual consumers. They're not built to be shared. They're not built to be shift-based. Like, can you imagine a world where, your personal iPhone, where at the end of the time you're at work, you just give it to someone else? Like, you would never do that. But if you didn't have to worry about bringing your phone into the workplace, but had a tool that did everything you needed it to do, and then you could just leave it behind when you left, That makes a huge difference. And the consumer grade device just wasn't conceived for that purpose. So it's a little bit of a square peg round hole. The promise of accessibility on that device, I think, has been met, but then you really need to start looking at operational excellence as the next step.
And I know for iOS, it's pure consumer, really focused on that. It's like a single person carry device. There are also Android devices that are also I would consider consumer devices, and I think that the Pixel is probably the first one, and it is Pixel's primary job from Google is to go up against the iOS and try to in the consumer space and try to compete against them. Do you see anybody rolling out Pixels in the enterprise space?
We have had people ask us about pixels, and specifically healthcare organizations ask us if we can use pixels with our tool set. The issue is because Google owns that device, they view that as essentially the paradigm of what they want Android to look and feel like from a consumer perspective. And again, they've not engineered it for the shared device situation. So a lot of what we would need to do to make it accessible to the shared device environment isn't unlocked from a Google perspective. Brett, I'm sure you could talk about specifically around device ownership and what you have permissions to do on the device that I think are going to be really limiting there. And I don't know if
Yeah,
you want to add color
I
from that
think
from
I think for
what
me, like there are a couple great vendors that we work with. So the ones that come to mind first are going to be, the Zebra, SpectraLink, Honeywell have um, their devices that are specifically designed for healthcare. That number one, they, like you said, they have the ability to have the management controls, security controls, and be used in a shared manner. But number two, they also have coding that is specifically designed for healthcare cleaners, so you can clean them with an astringent or a cleaner that's designed to be used in those environments. Whereas if you cleaned a Pixel or a iPhone, after about 4 weeks, it's probably going to lose a lot of its uh, outer coating or whatever it's called, the stuff they put on top of the grill glass. And then, the other option I've seen a lot of places where they'll put those inside of a case, and it just
Mhm.
makes it a lot clunkier of an experience for the folks that have to put those in their scrubs and carry them around all day. But yeah,
Yeah, absolutely. You know, in
I
some
do
of those
like that.
cases,
I do like those offerings
go ahead.
from a lot of those rugged manufacturers. And yeah, I agree with the assessment on the Pixel. It is definitely not as enterprise forward as a lot of
Yeah.
the enterprise specific companies, which is nice. That is a nice thing about the Android ecosystem is there are a lot of different manufacturers that have capabilities and features designed for subdomains. And a SpectraLink has had a lot of telephony capabilities and features that have been very heavy in the healthcare space and is loved by a lot of folks there.
Mhm.
I think one of the things we talked about the just transitioning from iOS to Android. We've done this at a couple places of going from iPads and iPhones, which I think the thing stands out to me is a lot of customers that the amount of repair they have to do on those because they do break. They don't handle the cleaners as well. I think we had one customer that was doing and this is a stat for if you do device maintenance, but their repairs, annual repair for, I think their rate was 200%. So every device they had to repair it twice a year. And so you can imagine a company that has 20,000 devices and is effectively fixing them or repairing them twice a year, how expensive that becomes. And so the cost savings they got by going with a carrier subsidized iPhone was quickly eaten into by the repair cost management costs. But I guess that being said, if somebody has iOS and they move to Android, what are some of the things that they have to do as part of that transition, or some of the things we've helped them with as they've done that?
Sure. So I think the initial thing is the tooling on the device itself from a mobile app perspective. Thankfully, most of the operational apps that are out there, if they're purchased off the shelf or commercially available, are going to have an Android version of that application. And in particular in healthcare, there are a lot of mobile applications that maybe initially were only on iOS because they were focused on that initial mobile environment in healthcare where there was the BYOD side of things. But Android has caught up quite a bit. So I think the biggest challenge is going to be making sure that you have comparable tooling on the device for your frontline workers is probably the biggest part of the transition. And There's a bit of a learning curve too, just because the Android operating system on the device does the interface is a little bit different. It is also intuitive, but it's just different. So there's going to be some transition and learning curve for someone who's only used to working on iOS to pick up an Android device and automatically know where things are. But it's a very short learning curve.
Yeah, I think with a lot of the search navigation type functionality, a lot of that's I would consider feature parity between those two platforms. I don't think there's any. I don't think there's one that does it better than the other. I think they're pretty comparable, but there is a little bit of like, oh, you got to press here, do this instead of this swipe motion. So yeah, I think it's pretty simple. I think the other thing I think about too is the infrastructure you can get for Android. There are a lot of additional capabilities around it. So the thing that I was thinking of is like things like charging cradles. I know there's charging cradles that third party that you can get for iOS devices, but there are ones that are specifically designed for Android. They have contact pads in the back, so you don't have to use USB-C. And a lot of those things actually increase the life of the device, improve the charging speed or charging ability. Like when you set it in there, you actually know it's charging. And I think a lot of those things, the ecosystem, you're having to put that infrastructure in place is a cost and it's a transition piece. But once you have it, it definitely makes the devices a lot more operational in our experience.
Yeah, I think that's a great point. It's a bit of like a retooling, but once it's there, because there is an ecosystem support around it. Like if you purchase a specific OEM Android device, like a Zebra or a Honeywell, for example, they're going to have charging cradles that go along with them that are made by them. It's not a third party that you have to go rely on. That one party charging cradle may not be as good as another.
Yeah, I think the other thing I like about the purpose-built devices, I'm going to call them, like the Android purpose-built devices versus iOS, is you can get devices that have certain capabilities that out of the box you're not going to see. And the one that comes to mind for me is RFID. So there are a number of devices from the rugged manufacturers that are including a built-in RFID reader. And from an experience standpoint, especially with the wristbands that we're using in a lot of the hospitals now, you can just have that built in and quickly scan or tap the wristband and get the information without having to physically scan a QR code or type something in. So there are other advantages too in that ecosystem you're not going to get with iOS devices.
Yeah, absolutely.
The next topic we had was around security. So I think I called it better security by design. And historically, there was a big perception of iOS being more secure than Android. And I feel like a lot of this was early on. Android was an open operating system, so there was variants that were created. People were, hackers were going in and doing things to have their own versions where they could rip software and put it on there. There's also a number of, I'm going to call them foreign companies that didn't necessarily have everybody's best interest in mind, that had cheap devices that were taking people's data. I guess I think recently we talked that a lot of people say that the Android may be more secure than iOS now, but what are your thoughts or key points for you around security for Android devices versus security for iOS devices?
Sure. So I think you touched on, there is still the need to make sure you're avoiding the unknown third parties. But if you do have Android devices that are GMS certified, then you can be certain that you're going to have the security posture that you need for the most part. Also, from an MDM perspective, management controls around what you can do on an Android device and what some of the OEMs are even exposing that can be done on those devices via the MDM is much more advanced than what an iOS device is going to do. Um, Finally, if you're trying to create a unified experience, or if there's security issues from OS upgrades on the device, you can control that much more easily on an Android device than you can in the iOS ecosystem.
Yeah, I mean, on that first point, just so everybody understands, so GMS is Google Managed Services, which is if majority of devices, if they're in the Google ecosystem, so if they run Play Store, they have to be certified by Google. And as part of that, the OEM has to include certain security features. Like they can't do things like store biometrics outside of a secure container. They can't share certain things like fingerprints. So there's innate security requirements that Google has for the manufacturers. But in addition to that, Google has tools they include with GMS around their new like Android Enterprise Device Trust, where it's actively looking for nefarious apps that might have been installed and containerizing those. Google's also done a really good job of protecting data. So they created a different process around shared storage in above Android 9, where they restricted what can talk to what. So now everything on an Android device has to be through a intent-based communication or a MDM granted process. So there are a lot of features that Google has added over the last 10 years to, I guess, debate or negate some of the arguments that people have around them not being as secure. And I think that at an enterprise level, the ability to, like Lee said, the ability to manage them and use the controls from the MDM, I think that is a lot more powerful than what you get with iOS. And iOS is a little less limited, or a little more limited than that, which is, I think, why we built BlueFletch specifically around the Android ecosystem. That being said, iOS does have really good use cases. Lee, when you think about the iOS, what are the key enterprise roles you see it in? Where do you see it going out in the field or being used in the field?
Where it's still quite effective. You see a lot actually in air carriers, pretty commonly for your frontline workers in that field. So a frontline worker I'm defining as above the wing, meaning like a flight attendant or a pilot, or even someone who's doing roving customer service on the floor in the airport, for example. You do see it a lot in those areas. Other areas I think you're still going to see it for a while is iOS does have a cachet around it from a luxury, I'm using air quotes under my desk right now, perspective. So I think there's going to be maybe some high-end retail that likes the perception of the premium that comes along with iOS. So I think it's not going to die out in those areas, but that's not the majority of the use cases out there, right? In terms of shared devices and where they live in the ecosystem.
So in summary, if you have mobile devices you're rolling out in the healthcare system or healthcare ecosystem, look at Android first. You can get purpose-built devices. They'll last longer. They're easier to manage. You have more control from the enterprise IT standpoint, and the security features are all there. So definitely look at that first. And if you have questions about it, we're always willing to hop on a call and field it. So reach out to us at info@bluefledge.com or ping us on LinkedIn or one of the other socials. Lee, anything else? Any other closing comments or things we missed?
One thing we touched on very briefly, and it's a whole other probably topic that we can get into, is the ruggedization of these devices and how there is a need for device life extension in every fleet of shared devices, but particularly in healthcare, because healthcare is a rugged environment too, just like a warehouse or something like that. You touched on the relative fragility of iOS, but correspondingly, there's a rugged side of it from an Android perspective. So I think that's important to keep in mind too.
That is a great call. I think we'll probably have to cover that in another topic. It's a good 20 minutes. We could probably rail on that one for. So thank you everybody for joining us today. And like I said, if you had questions, feel free to reach out to us at info@bluefletch.com. Appreciate it. Have a good one.
Thank you.
Thank you for listening to the Enterprise Mobility Roundup podcast. If you enjoyed the discussion, please take a few moments to rate us. If you would like to listen to future episodes, please subscribe. To learn more about mobility topics or submit any questions, visit us at bluefletch.com.